with you, Kaalaga. I'm student Nurse Marie at your service. For today's return demonstration, I will show you the use of bag technique. For a brief definition, bag technique is an instrument that enables the nurse to conduct nursing treatment with ease and agility during her visit, which saves time and effort and allowing the nurse to provide nursing care to her clients. The equipment needed depends on the client's condition, whether it's post-operative or wound cleaning and dressing. Remember to prepare all the necessary paraphernalia for good flow of service. Let's start the demonstration. First, protect the bag when you are going to visit the client by holding it in the middle of your body to prevent microorganisms. You can place it on your lap when you are inside a vehicle. Tao po! Magandang araw po. Ako po si Nurse Marie. Nabalitaan ko po na ang inyong anak ay may natamong sugat dahil sa isang aksidente. Maaari ko po bang makita ang inyong anak?
Opo, pasok po kayo.
Salamat po. Upon the arrival on the patient's home, place the bag on the table facing on you. But before that, get the clean paper out. The clean side must be out and the folder part touching the table to prevent contamination. Now, place the bag on the left side of the table. Ask for a basin of water or a glass of drinking water if tap water is not available to be used for hand washing. Consider the arrangement of the contents of the bag. It should be convenient to the user to facilitate efficiency and avoid confusion.
Thank you po.
Open the bag. Then put the holder on the bottom of the bag to avoid contamination to the materials when in use. Then get the towel. Put the used soap with soap dish and the used hand towel to the right side of the back of the paper. Remind you that performing hand washing is optional. If you prepared to use gloves, then you may do so. Next is open and wear the apron. First, one step backward away from the table so it will not touch to the contaminated area. Currently, the patient is suffering from surgical incise wound from an accident. It is needed to be cleaned and dressed. Take note that we need to assess the wound if it's infected or not. We can identify infected wound if you see these signs like swelling or inflammation, foul odor, pus in the wound, or secretions of fluid. Additional information, we have two types of wound healing. The primary intention healing, which means the skin can go back to its usual appearance, and the second intention healing pertains to the wound that is not capable of returning to its usual appearance. Let's move forward to the next procedure. On the second time around, open the bag and take out all the necessary equipments for specific care to have them readily accessible. The materials are for cleaning and dressing the surgical incise wound. The equipments are betadine, kidney basin and forceps, micropore, bandage scissor, alcohol, cotton balls, and sterile gauze pad. Then, the plastic receptacle. Put all the materials on the right side corner of the area. Then, close the bag. Proceed in performing the necessary nursing care treatment to give comfort and security and for faster recovery. In wound cleaning, we have different strokes depending on the wound. Bear in mind that when the wound is infected, cleaning should start from outer area coming into the inner wound. However, if it's a clean wound, it is the opposite movement of the infected wound. That the inside wound directly, then into the outer area of the wound. While in cleaning the drainage, it is the circular motion. First, in the inner part, then to the outer area. Concerning in the wound dressing, we have 3 layers that we could use. First layer, it collects the blood, fibrin, and debris. Next is the second layer. It collects the excess drainage. And the last one is the outer layer. It protects the wound from the external contamination. Ano pong pangalan mo?
Ako po si Lex Macho Gambali, sir.
Okay, Mr. Lex, lilinisin ko lang po ang sugat mo para maiwasan natin ang infeksyon. Okay lang ba?
Opo.
The surgical incise wound is not infected, therefore, we will directly dap the inner wound then into the outer area of the wound. Inner wound, then to the outer part. The wound dressing is only the outer layer. Put the used disposable items in the receptacle, then remove the used gloves to prevent spread of microorganisms. Then, clean all the things like the kidney basin, forceps, then the bandage scissor. Remove the apron, folding it away from the person. The soiled side is in and the clean side is out. To prevent the spread of microorganisms, then close the bag. After that, fold the paper and return it to the bag. Ma'am, wala naman pong infection sa sugat ng iyong anak. Kailangan lang pong linisin at iiwas sa dumi. Paalala lang po dun sa plastic na puti. Kailangan po itong sunugin at ibaon sa lupa para maiwasan ang pagkalat ng bakterya. Babalik na lang po ulit ako sa linggo ng umaga para sa follow-up care. Maraming salamat po, ma'am.
Salamat, Nurse Marie.
Take the record and have a talk with the mother. Write down all the necessary data that have gathered, observations, nursing care, and treatment rendered. Give instructions for care of patients in the absence of nurse. Then make an appointment for the next visit, either home or clinic. Taking note the time and the day for follow-up care. I hope my demonstration is clear. Once again, I'm student Nurse Marie, your future registered nurse. See you on duty and keep safe always. Bye!